Hello, my name is Nancy, and this is...
Hello, my name is Rowan. Welcome to our show, Hands on Health. This program was established by Deaf and Hard of Hearing Services in order to make sure that you have all of the knowledge that you need in order to make health decisions that are good for you going forward.
So today we're going to discuss the actual term pharmacy, and we have a guest speaker today that I'd like to introduce to you, Joshua Ford. Dr. Joshua Ford, welcome.
Hi, thank you. Thank you.
So just let us know what your position is, what your role is, and how long you've worked where you're at right now.
Absolutely, absolutely. So my name's Joshua Ford. Like you said, just Josh is fine. I'm an ambulatory clinical pharmacist. I work for Spectrum Health. I've been doing this position in Spectrum Health and previously at Spectrum Health Lakeland for about 5 years now. What that is I work in the doctor's office and help patients, manage their long-term disease states.
Okay, so you actually work in doctor's offices and you do that all the time, or do you actually go visit your patients? How does that work? You go to one office or you go to patients' homes?
Yeah, so we actually have a really robust team at Spectrum. I think there's 16 of us different pharmacists, and we're each in a different primary care doctor's office. And our patients come to see us just like they would come to see the doctor, and it just gets handled there like any other clinic visit. I do a lot of telehealth, though. I actually really like phone visits. It makes things fairly simple.
Great. So for general, in the pharmacy or pharmacist field, how do you label your patients? Do you call them patients or clients in general?
Generally, it's patients. It's kind of personal preference how most people interact. Clients. I know back when I was in Rochester, there was Rochester, New York. I used to practice there. There was a preference for clients where I was working over there, but typically it's patients.
So I'm just wondering, so you get referrals possibly to a patient's home or any specific location. Where do you get those referrals? From the actual doctor's office? How does that work?
Yeah, certainly. Pardon. Certainly. So the doctor actually, the doctor and I, and actually the whole care team, care managers and social workers and everyone else, we like to meet routinely. And what we do is we identify patients that are having a hard time. Either their blood pressures are running high, or their cholesterol is, they're having a problem with that, or they're having issues with their, diabetes, their blood sugars. And depending on the situation, if it's more appropriate for, our behavioral health specialist, we'll send them over to the behavioral health specialist. Or if they just need access to stuff, we'll send them over to the care manager and they can assist with, access issues. But if it's a drug problem and, their A1C is really high or their blood pressure is running really high, then they get sent over to me and I just kind of tune things up.
That's great. So your role seems to be really quite integral to the team. So now let's talk a little bit more about pharmacy or pharmacist in general. Most of our people would probably go to a pharmacy, a store where they would buy their medication. And what is the duty of the pharmacist there at a store? What would they typically do?
Yeah, certainly. So a pharmacist at like your Walgreens or your Rite Aid or any of your pharmacies there, so your pharmacist in that location is intended to, one, make sure you're getting the right prescription. You know, usually a technician will actually fill the bottle, but the pharmacist is the one who's looking to see and make sure it's the right thing in the bottle, right? And then also they look to make sure that the medication is okay and safe for you to be taking. With whatever available information they have, you know, other drugs that you might be on, any supplements, things of that nature. And again, you know, they're double checking the doctor as far as dose and route and everything else, just to make sure that it's the most appropriate and safe medication for you.
Okay, so I want to focus here on the issue of the pharmacist. Say, for example, a particular medication doesn't seem to be working for me. Do I contact the pharmacist or do I contact my family doctor, primary doctor?
I would say that depends, usually both. So let your pharmacist know, hey, this doesn't seem to be working, and I'm wondering if there's anything we can do. And certainly your pharmacist can talk you through anything that might be happening as far as like pitfalls, or maybe we're not using the medication correctly, or maybe we need to reach out to the doctor with an increased dose, something like that. That's always an option. But then certainly contacting your doctor's office and just saying, hey, this isn't quite getting me where I think I need to be, but can we talk about that? And hey, if you do that, you might get linked up with me.
So suppose I am looking for an over-the-counter medication. I know a lot of people call it OTC, but there's quite a few different products. Can I go to the pharmacist who's working at the store and say, which one do you think of these over-the-counter medications would fit me best?
Yes, absolutely, absolutely. Pharmacists, I always like to remind people, your pharmacist is a wealth of information. I said I don't like being called doctor. The reality is that most pharmacists have a doctorate in pharmacy practice at this point. So we're a wealth of knowledge. So please reach out to us. Let us know. There's all kinds of information we've got to help you pick the right drug or over-the-counter medicine or supplement, whatever you need.
So when we look at over-the-counter medications, sometimes, based on my experience, I'll purchase or buy a prescription, and that's according to the doctor's prescription. And that medication, when I get it from the pharmacy, I'll request the amount. What is it going to cost? And if it's extremely expensive, do I have the right to say no? Are there other options, like over the counter, that are very similar? Is that an option?
So that's a very long question. I think the simple way to say it is that you're not going to get the same effect out of an over-the-counter medication as you would from a prescription medication most of the time. The question of cost, however, is one that is very, very important. Medication prices fluctuate based on what pharmacy you're at and how they're contracted with your insurance. It's funny because people think that pharmacists have a lot of say on the cost, but we probably have the least amount of say. Most of it is contracting that happens well outside of my ability to manage. So I always encourage people, one, shop around. It's okay to look for a cheaper price if that medication is going to cost you a lot. Shop around and ask your pharmacist to see if there's anything that you can do. Sometimes there's copay cards, or there's a host of other options. And maybe it's just that specific medication is going to be expensive. Whereas if we took a different prescription medication in the same class that might do the same thing, it might be less expensive. There's a lot of wiggle room.
Interesting. Okay, well that, not me so much, but suppose a person has a lot of different medications that they take, and that person is doing some research and they found a medication that's cheaper at another pharmacy, and maybe it's possibly another medication, and then they find one at another pharmacy that's cheaper. Maybe the third one's a different price at a different pharmacy. It seems to me that it could become a problem because they've been going to this one pharmacy or the one pharmacist, and you know them well, but then they've found a cheaper one somewhere else. So how can you know which is going to be the best one to go to, and not have a conflict with choosing another one and going to another one while having a pharmacist that you normally use? How do you deal with that?
Absolutely, that's an excellent question. So, and I hear this one a lot, actually. So yes, there's absolutely that concern. It's called polypharmacy. We've even got a word for it. Patients who use a lot of pharmacies to get their costs down. So in medicine, I always like to remind people everything is a little bit of risk benefit. If we can't afford our medications all at one pharmacy, it's better to get them where we can and be able to make sure we're taking all the medications. And that actually kind of reinforces the what we call the medical home model, where you've got this team of individuals that really come around and wrap around you. Yes, the point pharmacist at the store has less visibility on your overall picture, but at the same time, it's a balancing act is probably the shortest way to say that.
Oh, that's really extremely interesting. That's a good question, Rowan. And so when you think of one particular pharmacy like Walgreens versus CVS versus Rite Aid, when you see the three different pharmacies, how do you know which one is cheaper? How do you research that to make that determination? So that's where I struggle.
That's an excellent question. As far as, most patients will talk to me about things like GoodRx or third-party websites that'll help kind of guide cost decisions, because, it's kind of handy. You just go on their website and you type in your drug and it'll tell you, oh, well, it's $30 at Meijer. That's kind of misleading because they're just giving you the cash price and their special negotiated price with that pharmacy, but it's not reflective of what you might actually pay with your insurance. So usually I ask patients, give a call, talk to the pharmacy, see if they can get you like an actual estimate instead of just whatever third-party website says. As far as guidance between different pharmacies, they're all kind of hit and miss. Some drugs are really expensive, at one pharmacy and then cheap at the other, and then it may be the exact opposite for a different drug. So it's really hit and miss as far as that's concerned. So usually just involve your pharmacist and see what you can do as far as getting that pricing to the best. The other thing you can always do is reach out to, I know Medicare's got a lot of really good programs, like the low income subsidy, and even one of the things I push is reaching out to the drug manufacturers, because they will, actually, they're fairly generous. As much as they get a bad reputation, they're fairly generous with just giving medications away for free.
Okay. So suppose a doctor prescribes a medication and I take it to the pharmacy, and I notice that it's super expensive and I can't afford it, but I'm thinking that maybe the doctor prescribed me a medication brand. Can I ask my pharmacist if there's a generic medication of that I can use?
Yeah, absolutely. So generic filling of prescriptions is actually the preferred way. I don't think a lot of pharmacists will fill brand by default unless there's not a brand available. So most of the time, it's already filled generic. But certainly asking I mean, pharmacists aren't infallible by any stretch of the imagination. So giving a double check and asking to make sure they did that is, it's not going to hurt. Oftentimes, if it's too expensive, the next step would be talk to your pharmacist and see if there's any way to make it less expensive, obviously. And then if not, if there's any alternatives, and then they can reach back out to your doctor with that.
Mm-hmm. Yeah. Okay, so I just want to clarify for our audience who might be watching, when we talk about brand and we talk about generic, can you tell us what the difference is and how they're different and how they're the same?
Yeah, absolutely. So the brand name drug is I like to think of it as the drug the first time it was used. So whatever brand name it is, it's the first one that was discovered, and this is what the drug is, okay? And then the generic comes around about 10, 12, 15 years later, and it's pretty darn close. It's the same chemical, it's about the same strength. I think it's 90, 95% as potent. It's really darn close, and it's made by a different company. And so they can make it cheaper. All the research was done for the brand name. They just have to replicate the chemical. So that's why it's a lot cheaper or less expensive.
I see. Now I see the distinction between the two. I've noticed that when you leave a prescription in a bottle on the shelf for possibly a year and then decide to go ahead and take that medication without looking at the expiration date on the bottle. So we may be looking at 2020 versus the current year, 2022. Is that medication still good, or should it be tossed out?
That is an excellent question. The correct answer is it should be tossed out because it's expired. There is research to show that sometimes medications last as much as 10 years past their expiration date that's on the bottle. But from a safety standpoint, a lot of people assume that it's more of is the drug going to be effective? And that's important. But the other question is it safe? Is it, has it become contaminated because it's not in its, original packaging, and, I may have opened it and it's in the bathroom cabinet or, whatever else. So who knows what's growing on it? So that's the other part of that question, not just is it effective, but is it still safe?
That's interesting.
Okay. So if I look at medication that's expired already, what is the best way to get rid of it? Should I flush it down the toilet? Should I throw it in the trash? What should I do with expired medication? How should I get rid of it?
Yes, absolutely. That's a great question. So there's a number of drug take-back events that happen every year. Those are usually targeted at your controlled substances, like your opiates, things like that. For general, day-to-day take-back, there are all kinds of green bins around. I know Meyer does them a bunch. There's a couple websites you can go to that'll help direct that a little more. But for most medications, that it's not super important that it gets disposed of safely, air quotes. I actually don't recommend flushing it down the toilet because then it winds up back in our water supply, and we don't filter for medications in most of our water treatment. So I actually recommend taking it and emptying out the bottles into used coffee grounds or something that's a little bit damp, used kitty litter, something like that. You empty it into that, so then nobody's going to go digging through your trash to get nasty, soggy pills, and then you just throw it away in your trash is usually what I recommend.
That makes sense. Sometimes, I'll have a supply, and then I'll discover that medication is old, and I've taken it to the police department where they have a special bin that you can toss it in. And then my next question would be, it's interesting that on the bottle, it's my personal information. Do I remove the label and dispose of it, or may I just throw it away with the bottle? Is that of any concern?
So I usually recommend that patients destroy their information that's on the bottle. I mean, from a healthcare setting, it's technically protected health information. You don't have to like tear them off. Usually those are heat-based printers though, so you can actually just get them hot, get them warm, and it should just kind of black out the whole label. That's an option. Or if you feel like peeling them, like myself, and then just using them to start your fire or whatever. So.
Thank you for those suggestions about the heating part. Here I've been picking at those labels, which take forever.
Yeah, so now I would like to discuss sharing medications. So yeah, we've heard some stories about, possibly two people who have the same medical health issues, and they feel like one is out of their medication and they're like, I have no time to go to the pharmacy, and the other person is like, oh, go ahead and use mine.
Yes.
Is that appropriate or not?
That's one of those questions that
That's grandma's and grandpa's medications, right? Or maybe a friend's.
Yeah, that's one of those questions. It's funny. We all know the answer to that, and we all have a tendency to break that. So no, absolutely, you shouldn't be sharing medications, right? And really, each medication is intended for that specific person. And so most people are hearing this and they're saying, well, Josh, I know what I'm doing. I know it should be safe. I want to share with you a quick little story. Back when I was a burgeoning young pharmacist, I got a patient who came to me, lovely young lady, and was having some problems with her blood pressure. And she had her blood pressure pill. And unbeknownst to her, or maybe she just didn't realize, but her blood pressure pill had changed about 3 times over the course of 2 months. But she wasn't really taking them all that often, and so she just took the new blood pressure pill and put it into the bottle from the old blood pressure pill. So we had about 3 different blood pressure pills all in this one bottle, and it was all labeled with one name. But the reality is that it was 3 completely different medications, and she was just taking whichever one happened to fall out that day. So it kind of goes back to, no is generally the best option. So absolutely don't share the medications, because from a practical stance, even if you think you know what you're doing, oftentimes, we're all human. We all make mistakes,
I know based on my experience, I know my body. And I have the option to tell the doctor that this medication is not a good fit for me. There are times when I see a doctor who doesn't really understand me physically, but we can have that discussion about my medications, correct? For example, to make the assumption that the doctor knows everything and not question his or her recommendation. I mean, should I tell the doctor, say for example, if he's giving me something for a headache, how do you handle that? It should be a discussion, not just strictly the doctor giving me their advice.
Yes, absolutely. So I 100% agree. I'm actually a really big fan of patients advocating for themselves. That's number one. If you're not feeling right, then we're not doing you the best we can. That's kind of my approach. The standard diseases, the things that you have going on all the time, that should all be really well tolerated. And if it's not, then you should absolutely be having a discussion with your doctor or your pharmacist or whoever else about trying to figure out how to get that as best tolerated as possible.
So for me, I'm obviously a patient, and I've got prescriptions. Maybe my health is deteriorating, and the doctor gives me a new prescription. So I've got all these prescriptions and I add this new prescription onto it. If I have concerns about all the medications that I'm in and if they might have issues with each other or, conflict with each other as far as the medications and the side effects and all of that, do I ask my doctor or my pharmacist or both?
I love that question. I'm a big fan of both. However, I'll add with a teensy bit of, there's a phrase. There's a phrase. I'm sorry, I'm having some word finding. No, take it with a grain of salt. Thank you. So take it with
I have a question that's very similar to Rowan's. For example, if you have 2 bottles of medications, one may be taken in the morning and the other one may be taken at night, or can you take both at the same time? Could that be a contraindication? If you take both of those, do you have to strictly adhere to taking them at separate times? Because sometimes if you take them together, it causes problems.
Right. So I think that's a little bit overstated, and it actually goes back to Rowan's question a little bit. Take it with a grain of salt, because the reality is if we put it through a bunch of different processing software, what happens is you get a whole list of interactions and everything else that may or may not be pertinent. And the same thing can be said about, if you take 2 drugs at the same time. There's a potential that you could get a huge list of interactions from the software, but from a practical standpoint, oftentimes that doesn't matter so much. So honestly, the short answer is confer with your pharmacist. Have a good conversation. I know most pharmacists are totally capable of doing what we call complete medication reviews, and I'm a big fan of going through those. And what it is you sit down 1-to-1 with your pharmacist, and you'll start at the top of your list and go through everything that you're taking, herbals and supplements and prescriptions and everything else. And they go by one and make sure that we all know exactly what you're doing at home. And then they take all of that information, they compile it, and make sure that it's all safe and reasonably the best therapy for you. So yeah, it certainly doesn't hurt to ask about that at your pharmacist, at your local pharmacy.
Oh, wow. Okay, that made me think of something. So you talked about vitamins, supplements, all of that kind of stuff, along with prescriptions. So yeah, I'm thinking, do those cause any contraindications as well? Like, do I need to let my pharmacist know I'm taking this vitamin, I'm taking this supplement, and do I let my doctor know as well? Because those might have a problem with some of my medications too, right?
Yes, absolutely. A lot of those actually do have a pretty significant interaction. Notable ones, of course, like St. John's wort or ginkgo. So those things absolutely do interact, and it's important to let all of your healthcare team know what you're on as far as those supplements are concerned. Certainly.
Ooh, very interesting. That was a good question, Ron.
It was.
I have a question about if I'm brought to the hospital. And when you look at those medications that I generally take, of course, I wouldn't be in any condition, but my family would be bringing those medications. But if I really had a problem, if there was a contraindication as a result of that, would the pharmacy be contacted to cancel that specific medication? Because obviously it's not good for the patient. How do you communicate with the pharmacist?
So that's a fun question that you asked there. Should it happen? Yes, it absolutely should. I 100%, if you had an issue with a medication, it should be communicated. Most of the time it does. There's a lot of electronic software handling that happens behind the scenes that it should be sent over to the pharmacy immediately as soon as it's canceled on the big health record side. Should being the operative word there. Often, like any system, there's always failures. So I'm a big fan of, again, patients advocating for themselves. If you go to your pharmacy and they're like, hey, what about this medication? You haven't filled it in a while. Yes, absolutely, I haven't. Don't fill it for me. Make sure you cancel it. And that's a totally reasonable thing to ask of them. Everybody should be double checking everybody.
Sure. So obviously it seems like it's really important for us as patients to advocate for ourselves. That's a very important message that we're putting out there today, right? So Nancy, do you have any other questions?
No, absolutely. We should be our own advocates. No further questions. Thank you.
Yeah, thank you so much for coming, Josh. We really appreciate this conversation we've had today. Thank you.
Thanks for having me.
Thank you.
Thank you for joining our show today.
Yes, thank you for watching and learning more about this particular issue. And hopefully you'll be watching again the next time, and we will be discussing another health topic. You can always contact Deaf and Hard of Hearing Services on our Facebook page, and also subscribe as well as with YouTube and see what your options are. That would be www.defhhs.org. Donate. If you have any questions about this particular topic, or if there's some particular issue that you would like to discuss, please contact Hands on Health at defhhs.org. So you'll see you have both options, one for donations, one for questions. Thanks so much for watching. Thank you.
Yes, and thank you, Josh.